Hi friends, today I have the honor of introducing to you Dr. Ashwin Parchani. He is the rank 43 in November 2019 AIIMS. And even more important, I want to point out at the outset that he started at a rank of around 9,800 in the last NEET exam. He took it as a challenge and he realized that he could do well, and he continued for one more year, and now he's sitting at a rank 43 now in the November AIIMS, the most sought after institute in the country. So Ashwin, heartiest congratulations.
Thank you so much, sir.
How are you feeling today?
So it's an amazing feeling, sir. Like I never imagined this could happen, sir. Like initially in November, last year November, I was planning to give USMLE, and I got an extension to read for the step one. And then I thought that I should give the NEET 2019 since all my friends were also giving. So I attempted NEET 2019 and got a rank of 9,800, and that was purely on my knowledge of third and fourth year subjects. So then I thought that why not attempt AIIMS May and NEET in 2020. So yes, sir.
So, and then you decided to join the regular program in DAMS. You
Yes,
did a
sir.
regular course in DAMS Kolkata.
Yes, sir, I joined DAMS Kolkata in April of 2019 this year, and I've been a regular student for the past 6 months. Yes, sir.
So, if we take home a message that it is possible to even start as late as April, and before that you were always thinking about maybe USMLE or something else, and in as late as April of this year you joined a regular course in DAMS, and it is possible now to improve into 43 rank. Is possible?
Absolutely, sir. Absolutely, sir. There's no magic formula for success. Only two things: hard work and perseverance. Nothing else. I mean, like I've been following motivational messages by so many athletes, by you, sir. There's no magic formula for success except hard work. I think everything's possible, and like in my case, in MBBS, when I joined MBBS first and second year, I did not take it seriously. My first and second year subjects were extremely weak, extremely weak. So I had to compensate for that in this 6 months, and I was able to do this because of the excellent coaching by DAMS, sir.
And you were a part of a regular course in DAMS Kolkata. How was your experience with the regular program and the teachers and the
So
discussions?
it was amazing. So I used to be excited for almost every next class. Like I remember one of my first few classes was by Dr. Saurabh Dixit, sir, and I became a fan of him in the first class itself. Like next day, usually I used to come to the class at 9 o'clock, like 10 minutes before the class starts. But for his class, I reached the venue at 7:30 in the morning just to get a front seat and a good uh, attend the class properly and have a good time there.
Many students, when I talk to them later on, they tell me that during the DAMS classes, many times between the classes, they have those eureka moments. There were so many of their things that they could never understood.
Absolutely.
And during the class, when you understand, it gives you that joy.
I'm having that joy right now, and I'm thinking of those eureka moments. Like the concepts that you get in regular classes, it's impossible to get when you're reading a book. It is very important for some concepts to be explained by a teacher, and for a student to be present and listening to it with full attention, and then seek that knowledge. And eureka moments are infinite, so I can say honestly, especially like in subjects which for example, psychiatry. Barely anybody focuses on psychiatry during MBBS. But when I attended class with Dr. Sachin Arora, my eureka moments were like again, that was another class where I reached the class at 7:30 in the morning just to like have a nice time in the class and like enjoy the class.
And I believe that when you start enjoying the learning process, irrespective of the end result, so it's slightly difficult to achieve at your age. I understand that, but truthfully, I believe that the reason you have been able to improve so much is that you were enjoying the learning part.
Yes, sir.
Sometimes what happens is, as children, we tend to over focus on what will I get, what will be my rank, but we ignore the process of enjoying the learning. So that is very important to do. You have to enjoy learning, and that is where I believe that entire student teacher relationship and those mentorship and the classroom, they come into play.
Yes, sir.
Because when you find somebody explaining the things to you like the way you want them to, you kind of form an invisible bond.
Yes.
And that might not be visible to the teacher, but because your teacher is teaching a classroom, but you feel it, and you start the knowledge starts flowing from the teacher to the student.
I agree, sir. Like even during the exam, I was having flashbacks from the class itself that this was taught at this particular time by this particular professor, and that professor did mention that this question is a very high yield question and it's a probable question which has not been asked before, but this time it can be asked. So those were like moments that in the exam also I was like actually enjoying giving the exam, because when you see a question that is being asked directly from your notes, that's a totally different feeling. You can focus on other questions where you have to like sit with them and think about your previous knowledge and correlate and then come to a question. And there were some questions directly from notes where you don't have to think much. So yeah.
Were you happy with the quality of notes that you made in the class, sitting in the DAMS classes?
Yes, the notes are the only thing which can help a student in the final 15-20 days. And I think that notes should be read, like people say that some people should read notes for 3 times minimum or 4 times minimum. There's no minimum times you should read notes.
And that notes give you that handy go-to material when you're revising.
Yes, sir, absolutely. So notes are like a must. Because when one makes the notes by himself or herself, they can actually remember better. And notes are the only thing one can rely upon in the final few days before the exam, when everybody is confused. What should I read? Where should I read from? Should I read this or that? That is the perfect time to open your notes, revise them as many times as possible. And it should have been read before. It should not be read just before the exam. Notes are like, you should consider them as a holy book. You should read it at least 4 to 5 times minimum, and just keep revising them as much as possible.
Do you think that your go-to material for revision, if you have to advise anybody, would be the DAMS class notes?
Yes, sir, definitely. Undoubtedly, sir. DAMS class notes, I can say that in the recent AIIMS paper also, there was so, like, everybody knows currently, like, almost there were around 120 questions directly from notes, and 30 to 40 questions one can correlate from notes and come to the answer. So it's very high yield, sir.
Yeah. And did you also attend the DVT session that we conducted?
Yes, sir.
How was your experience?
Yes, sir. So I attended DVT in Calcutta, sir, satellite DVT. It was very good. It was immediately after my CBT, because in Calcutta we had it later.
Yeah.
And my CBT rank was not that good. But when I attended DVT, it was like the revision that I got through DVT, plus the final words of wisdom by all the professors. That is something that I value till date. That DVT was actually like the starting point where I thought it is possible, even in 1 month of preparation, that I can do this.
So, you're talking about the CBT. How was your CBT experience, and what was your rank in CBT that you were mentioning right now?
So my rank in CBT was 2800, and I used to give grand tests on a regular basis for the first few grand tests, and I used to get little demotivated when I didn't get a good rank. But then I thought that it's better to make the mistakes now rather than making it in the exam directly, and I kept practicing. So my main goal was before the exam to focus on my weak subjects, and that was my only goal, because I knew that students usually read third and final year subjects very they read it properly in the the third and final year, and revision is not exactly required for those subjects in the last moments of the exam. First and second year subjects are those where somebody needs to revise again and again. For example, like forensic, the IPCs, it is very important a student revises that just a day or two before the exam. Then again, other subjects like microbiology, where again media and other things are supposed to be revised 1 to 2 days before the exam. So my main aim was to focus on my weak subjects in the last few days. And
so if I put it in a nutshell, that towards the end days, your strategy was to look at things which are more volatile, more factual, and things, the subjects that are your weak subjects.
yes, sir.
So if I say that maybe after the CBT exam you got more revisions into place and you worked more on your weaknesses, and all that contributed, because in 1 month you have done a massive improvement. Many people would not believe that somebody can get a rank of 2800 and improve to top 50. So, but I think it is possible if one works constructively towards the things which went wrong. Every exam is a learning experience. After that, you learn what went wrong, and you are able to see that if I can improve on these counts, I can improve. And here he has improved from a 2800 rank in October CBT.
Yes, sir.
And he went on to get a 53 in November AIIMS, a 43 in November is 1 month. So it is possible to do well even in 1 month. Reason I'm emphasizing on this is because many of the candidates who are listening to us today, 1 month later will be appearing for NEET exam, and they are wondering, will I be able to improve? I am telling you, yes, you can. There is a massive possibility to improve in 1 month. 1 month is a very significant time. Very significant.
Yes, sir, I completely agree with that, sir. Plus, like, people who are watching this, just think about the game of T20 cricket. Last 4 overs are when the batsman hits the most runs and can change the game. Andre Russell can score 80 runs in 6 overs. In 1 month for cracking any exam, I think you should have that motivation inside you and just focus and work hard. I think it is definitely possible.
Were you happy with the Ematic OSAP that we had given you, on which we had the previous paper discussions, we had the DQB, the AIIMS capsule, emergency medicine module? Were you happy with that?
Yes, it was extremely high. So, what I used to do was I used to read a subject, and then at the end of the day, I used to finish the subject revision by solving a SWT, which would tell me where my weak areas in the subject are and what topics I need to focus on more. And about AIIMS capsules, what I used to do is, like, the thing is, immediately before I used to go to sleep, that is the most low yield time when somebody cannot focus on any new topic at the end of the day. So I used to watch a video instead, because what students usually tend to do is they go to bed and they think about other things, like it is not possible. That is what happened with me in the initial few months. I used to go to bed and think that acha nahi hoga, it is very difficult. Those negative thoughts start coming to mind. I started using it productively and started watching videos at the end of the day, and that's how I solved the entire AIIMS capsule. Like, I started watching it in the month of September, and I used to watch one every night and before sleeping, and I finished the entire AIIMS capsule before the exam.
And the beauty of these AIIMS capsule and the emergency medicine are, these are like doable courses that we have created. Like, these are not, they are not like infinitely lengthy. They are small, crisp courses where only the most high yield things are touched upon.
Yes.
And in the AIIMS capsule, we have touched upon all the important topics that have been asked in AIIMS in the last 3-4 years. We have touched upon all those topics. So somebody is hearing them, is getting that idea on what is high yield for the exam.
The AIIMS capsule is a must for any student appearing for AIIMS. AIIMS capsule is a must. There's no period, like there's no after, like you cannot cannot give an exam without reading AIIMS capsule, be it NEET, even be it PGI. AIIMS capsule is a must. And so emergency medicine also is a very high yield resource that was provided by eMedicos. And AIIMS has a habit of asking questions on emergency medicine. At least, like, in the previous year, there used to be 4 to 5 questions on emergency medicine. Plus, they also focus on areas which one usually like on things which are done by a intern during his internship, like IV cannulas and other things. So it is important that a student go through AIIMS capsule, as well as mm, uh,
and I also want to, ask you about the DAMS club, the Facebook group where we could do the doubt solving. Were you happy with that?
yes, I used to go to the dance club regularly, sir, but I used to directly go to the photos section where all the uh, teachers have put high yield photos. Like Diksha Sikri ma'am's photos were like amazing. The high yield pathology revision, sir. I didn't go to the club because mostly it was filled with, like, some people used to put controversies, which I never dealt upon, because controversies are not asked. That's a fact. Like, some people get scared of ये पूछा जाएगा या वो पूछा जाएगा, like anesthesia, sensitivity to anesthetics, that is not asked. Like, so I used to go directly to the photo section and revise the high yield tables from there, sir.
Coming from you, I think it is a very significant point for future aspirants also, that unusual things, controversial things, don't run after them too much. They're unlikely to be repeated. In this same exam, it was all about the usual things, the most important things, and they've not deviated from that idea.
No, sir. I gave the AIIMS in May exam, and I can see the paper pattern is the same. They focus on clinical areas a lot, and even if a student doesn't know an answer, if he just looks at the questions, spends some time with them, correlates, and rules out options, I think it's possible to come to an answer.
You've also given PGI exam now. How was the PGI exam different from the AIIMS exam?
So PGI exam focuses on theory and on first and second year subjects, as well as final year subjects, while AIIMS focuses on first and second year subjects more. PGI exam, sir, it was more of theory, no pictures, like no picture or video based questions were there, and It was basically like students who need to have a thorough knowledge of the subject rather than just high yield points.
This time it was a computer-based test in PGI Chandigarh. Did that interface feel a bit different, or like you have given the May PGI also?
Yes.
What was the
So
difference?
it was more student friendly, sir, because used to like a lot of time is gone in darkening the circles in the exam, and this time the PGI exam I attempted 430 to 440 questions, and I finished the paper in 2 hours. So and I had time to revise. So that was one benefit of the computer based exams.
Okay. It reduces the time, I think, the
Yes, sir.
time that went into circling and the blackening the circles. And
Yes,
all that.
sir.
Yeah. I think it's more comfortable, more transparent. I think it's a good step forward that they've gone to a computer-based test, and it becomes easy also for people across the country to reach the centers. Earlier, it was run only on one center, and I think that makes it more practical now.
Yes, sir, absolutely.
I think more and more people will target the PGI exam in future because of the proximity to the centers now.
Yes, sir.
And any particular topics that you want to mention to a May aspirant, that anything that he should prepare, especially for AIIMS and PGI, any topics that he should not miss on?
I would recommend one to first go through AIIMS capsule. First, know what is high yield first, and then if you want, you can see photos from books like Sabiston and Harrison, because photos come directly from those books or they come from other sources. But it's better to look at the pictures before giving an exam. Secondly, I would say pharmacology is an important topic which was focused more this time, and clinical subjects, I think that somebody who is doing internship right now, if the person focuses on an internship, he can easily get 20 to 30 questions in the exam.
Anything in particular for PGI exam?
PGI exam, all I can say is start early, have a thorough knowledge about the subject, and read DAMS notes, plus complement them with your standard books if you can. Like you must have underlined it during your MBBS years. I think that would be a good strategy. And only attempt what you know, because like you get credit for that and not for the wrong, like it can actually deduct a lot of your marks if you attempt. For example, last year the topper attempted 590, and the student who got rank 12, she attempted around 390. So that's the difference marking can make in the exam.
Very practical points. And any particular teachers who come to your mind today?
Yes, sir, everyone, sir. Like DAMS faculty is like an all-star team. So firstly, I would start with Dr. Saurabh Dixit, who took one of my first classes. Then Sachin Arora sir, like the interest I had in psychiatry after joining DAMS, like I cannot thank him enough, sir. And Deepthi ma'am, her notes are so good. Like it is impossible for any examiner to set a question in OBG out of her notes. It is actually impossible. Her notes are so complete, so complete. If a student just reads that properly, I think he can attempt all questions, undoubtedly. And then, sir, even Sanjeev Chitragar, sir, he actually predicted a few questions in the AIIMS exam. He said this is a very high yield topic. So I remembered I had that flashback during the exam. So I would like to thank him also for that. And Ranjit, sir, Diksha Sikri, ma'am, everyone, sir.
And I think in the end, when we reach to this point, the success is about the content that you have, the knowledge, the exam skill, but it is also about the mindset. So
Yes,
how
sir.
did you manage your mindset in this year? Like there would have been ups and downs. Like how did you manage that? What did you tell yourself, and what was that motivation that helped you?
In the initial few months, it was all down, sir. Because when you start preparing, you come to know that these are your weak subjects, and then you start having thoughts that how will I overcome these. But towards the end, if you just be consistent with your notes, be consistent with your strategy. It's important to have a plan, and just keep up with the plan. Read the notes again and again, and it is definitely doable, sir. Like during my CBT, when my rank came 2800, I was very demotivated, sir. But after DVT, when I saw your motivational message, sir, I was like, I have to do it. Like, so after that, I isolated myself. Like in my house, also, I had a lot of fight with my family. I'm sorry for that, dad and mom. So I had to isolate myself and focus on my weak areas, and though that last 1 month actually counted a lot for me. I would say 80% of what I did in the exam did that last 1 month had the contribution.
So it is important to utilize the coming 1 month for the NEET PG aspirants. don't dishearten that कि आखिरी महीने में नहीं कर सकते. There is a lot to be done in 1 month. 1 month is a big time. बहुत घंटे हैं, बहुत hours हैं. You just need to cut out the negativity and bring more positive energy into action. You have to work with total optimism, total positivity to make it happen. There is a possibility to do it now. He has done it now. I'll again reiterate, again discuss with you. He started at a 9800 rank in the NEET PG exam. Now, 10 months later, he is at rank 43. He's a regular course student. He had a not so good rank in the CBT. He did not let him affect him. He was always on the go that I want to do it. And now he's sitting with the possibility to get into the dream college that he always dreamt about. That is AIIMS.
Yes, sir.
Which branch do you look forward to take in AIIMS?
Sir, my first preference is general surgery, sir.
Let's hope for the best. Let's hope that you get the branch of your choice in the place
Thank
of
you,
your
sir.
choice. I would once again like to congratulate you on your achievement, and I would like to congratulate your parents for
Thank
this
you, sir.
awesome achievement
Yes,
on
sir.
your behalf. Congratulations.
Thank you, sir.